Hi, this is Kerry Shearer for the National Public Health Information Coalition. And as a fellow public health communications professional, I want to ask you a question. How prepared are you for the next full-on public health crisis? You know, many public health communicators really got their first dose of crisis emergency response during the H1N1 flu pandemic. If that's you, congratulations, you survived. Or maybe you've become a public health communicator since the pandemic. Public health communicators have really had their hands full this summer dealing with wide-ranging issues. Heat emergencies, weather disasters affecting many parts of the country, smoke and health impacts from massive wildfires, issues like bath salts. It seems like the list just goes on and on. Now, whatever your situation, I want to make sure that you do not miss out on what I think is this year's most valuable training opportunity. It's the National Public Health Information Coalition's annual symposium featuring CIRC-2 crisis and risk communications training. Look, I know many of us find it hard to leave the office. There is so much to do. Travel funds may be tight, but I want to assure you that it is totally worth the investment of your time and budget. The 2012 NPHIC Symposium goes far beyond what you would traditionally expect from an industry conference. Public health is facing extraordinary challenges, wouldn't you agree? But also lots of opportunities, and there is no more business as usual. Now, recognizing that for 2012, we have transitioned to the all-new symposium format, and I am so excited about it. We're bringing in the absolute best, Dr. Barbara Reynolds, and the focus of the symposium is on crisis and emergency risk communications. Dr. Reynolds literally wrote the book on CIRC, and she's going to get you up to speed on the all-new CIRC 2.0, which contains tons of new information, especially on the use of social media in emergencies. This is really critical information that you need to know so your agency can just nail it in a crisis when the pressure's on and the public is depending on you for timely, accurate response across all platforms. Now, we've seen what can happen when an organization is not properly prepared to respond. That is no position to be in, believe me. When the media and the public are expecting information, the issue has exploded across social media, and you're struggling to even put together an initial response plan or comment. The CIRC 2.0 training is going to help get you response ready, and it is totally valuable. All right, now think about this. What usually happens at a conference session? Usually at a conference, you hear a presentation from a big name speaker of some sort. You write down some key points that they cover. They answer a couple of questions at the end of the presentation. They run out of time, and then it's over. It's done. They're gone. Well, not at this event, because one of the amazing things making its debut at the 2012 NPHIC Symposium is the inclusion of thought leaders. Now, what's a thought leader? Well, these are experienced public health professionals, some of the best minds in the country, who will be integrated throughout the symposium, even sitting at your table, helping to encourage you, to inspire you, to answer your questions and advance the field of public health communications. Who is it? Well, it's people like Dr. Jay Bernhardt, the former director of CDC Health Marketing, David Faust, Director of Communications with the American Public Health Association, Norm Hartman. I know Norm. He is the go-to guy to prepare you for media response. That's only part of it, too. There are 9 other thought leaders with amazing credentials who are going to be embedded in the conference and available to you, creating an unprecedented learning opportunity. Now, time is of the essence. The symposium is coming up September 30th through October 2nd in Washington, D.C., and you've got to hop on this now to get registered and get your travel arrangements in place. Don't take a chance on waiting too long and then missing out on the special conference rate or availability at the Mayflower Hotel, or getting stuck with some budget-busting airfare. Registration is available right now on the NPHIC website at nphic.org. Now, if you're new to NPHIC, and you haven't attended the annual conference before, by all means, don't miss this conference, whatever you do. When I was new to public health, the NPHIC conference got me immediately plugged into a network of colleagues that I have depended on. I've bounced ideas off of, I've exchanged information with them, and it has been so valuable to my career, and I think it's going to be to yours as well. And if you have been to the conference before, this is going to be like no other. If you don't attend, you're going to miss out hearing from the experts on the key steps that you need to take to plan for and excel in a crisis. You may miss critical information that can help you take your social media outreach to the next level. And you won't have the opportunity to have face-to-face interaction with the nation's top public health experts. Don't miss out on all of that. Now look, I'm not going to take up any more of your time right now. You've got a memo to write requesting travel permission. All the information you need is right here on the NPHIC website at nphic.org. We're really looking forward to seeing you at the NPHIC Symposium in Washington, D.C. beginning September 30th.